A 25-year-old male was just rolled into your trauma bay after a high-speed motorcycle crash. He's combative, confused, and his GCS is hovering at an 11. Your first instinct is to blame the alcohol you smell on his breath. Stop. In this bay, we never assume alcohol is the sole cause of altered mental status. Check the bedside glucose immediately. Hypoglycemia mimics trauma, and missing it is a choice you can't undo. Look at those pupils. The left is sluggish, 2 millimeters larger than the right. That's not the booze. That's an urgent intracranial pathology. You need to keep that PaO2 above 60 and maintain a rock-solid blood pressure because every drop in perfusion is permanent brain tissue lost. Now check all 4 limbs. You're looking for any deformities, limited motion, or lateralizing signs that point to a focal neurological deficit. Before we transition to the secondary survey, we have to see everything. Get the trauma shears and undress him completely. I mean every inch. You're searching the scalp, the axillae, and the perineum because occult wounds hide in the hair and the folds. We're going to Logroll him now, but look at the pelvis first. If it's unstable, we do not roll. We stop. If it's clear, the team leader holds the head for strict C-spine control, and the other 2 medical staff move the patient as 1 unit on the leader's count. While he's on his side, I'm palpating every spinous process for a step-off and performing the DRE. I'm looking for anal tone to rule out a cord injury and checking for a high-riding prostate. If it's boggy or impalpable, we've got a urethral tear and that Foley catheter stays on the tray. Once he's back down, cover him. Now, if he hits the triad of death and gets hypothermic, his blood won't clot no matter how much you've sutured. The key lessons here are simple. First, a traumatic GCS always earns a bedside glucose and a pupil check to separate metabolic mimics from surgical emergencies. Second, never consider a patient fully examined until you've visualized the hidden regions and cleared the posterior chain with a coordinated log roll. And finally, maintain the physiological environment by aggressively preventing secondary brain ischemia and the lethal spiral of hypothermia.